All right, thanks so much. Warmly welcome our guests, Professor Dr. István Ulbert, Professor Dr. Niklas Marklund, Professor Dr. Elena Moro, and hopefully online, Professor Geert. I hope he could be online together with us.
Yes, can you hear me?
Yes, we can hear you. Warmly welcome.
Thank you very much.
So thanks so much for accepting the invitation for this esteemed event. My name is Zsolt Iván. I'm a Customer Care Division Director at Femtonics. And we were asked to discuss a really interesting topic right here in the parallel session number 2 about several incentives. And in the beginning, before we jump into the details, I just would like to ask the guests to introduce themselves just in a couple of moments and in a couple of sentences. So if you don't mind, I just pass forward the microphone to you.
Okay, all right. I can start. I'm Professor Niklas Marklund, neurosurgeon in Lund, south of Sweden. I'm also representing myself and my university, but also the European Association of Neurosurgical Societies, the EANS, working predominantly on traumatic brain injury in various forms. So, yeah, in brief.
Thanks a lot. I'm István Ulbert. I'm Director of Cognitive Neuroscience and Psychology of the Hungarian Research Network, and I'm also directing in part-time the neurosurgery clinic research background. Actually, I'm a medical doctor, but also an electrical engineer. I'm interested in oscillations of the human brain, but also I'm a tool maker for neuroscience applications.
Thank you. Elena Moro. I'm a professor and neurologist at the Grenoble Alpes University in France. I'm also a movement disorder specialist, and I'm the current president of the European Academy of Neurology, which gather for 45,000 neurology living and working in Europe.
And Professor Geert.
Yes, thank you and good afternoon. And my apology that I cannot join you online, but thanks in person, but thanks for the invitation. So my name is Geert. I'm a professor of addiction psychiatry at the Antwerp University, based in Belgium, but I'm here as the president of the European Psychiatric Association, which is an association very similar to the EAN, and we cover about 78,000 psychiatrists overall of Europe. So very happy to be here.
Thank you so much. Thank you so much for all of you. And it's really remarkable that we are among your circle, because you are very, very diverse topic, and you are working in a very, very diverse field. And it will be really interesting to see the different point of view on the same topic. So if you allow me, I just would like to ask a really interesting question from each of you, from all of you. What would be the $1 million question in your field, on your daily work, which makes the greatest headache, and how would you like to resolve that, which are related to the brain health and the different brain studies? I just pass it forward to you at first.
Oh, thank you, Zsolt. I think for us, the most important question is how can we reduce the burden of neurological disorder in Europe as fast, as efficient as possible?
Sure, I represent a sort of my study disorder that's very common, for which there's basically no treatments whatsoever. So we're entering the era of precision medicine. But how can we take the complexity? The traumatic brain injury is considered the most complex disorder in the most complex organ in the body. How can we take this complexity and develop it into treatment? What's been done so far, taking trials, clumping everything together, all subtypes of traumatic brain injury, and give them a drug and expect it to work, is not going to happen. How can we refine, how can we be more precise when we develop novel treatments for specific targets? I think that's general for all brain disorders in a way that are very heterogeneous.
Okay, thank you. Since I'm from the research part, and actually brain research part, we are interested in how brain works, and also because of my background, my engineering background, I'm really in the designing of different types of devices that indwell in the brain, and with these devices we can actually figure out what kind of mechanism are in work during cognition, for example. For me, the million-dollar question is, how can we achieve a much better way to develop these devices in Europe? Because as far as I see, you know, Elon Musk, the BrainGate, an initiative, and others from actually China. Europe is getting a little bit in the other side of the row, in the back side of the row, in terms of device development. And I think that is a question that we have to address at some point, because then we will lose ground if we can't keep up with these devices and actually to improve the daily life of people with neurological disorders and diseases.
Professor Geert?
Yes, thank you. The million-dollar question for me is, what can we do to help our children not to develop psychiatric, mental health, even brain disorders? So what can we do early in childhood to avoid development and chronification of mental health problems?
And do you have any sort of suggestion to find a resolution for this?
Like every million-dollar question, there is no solution for that. That's why it's a million-dollar question, so you never have to pay $1 million as a definition. But yes, there are, I think, a lot of things we can do about early screening, learning to see where are the vulnerabilities in, for example, cognitive mechanisms, in, for example, developmental issues, etc., and offering very early targeted interventions for those young people and children who have these vulnerabilities. Now, it's a combination of these things, and I think I refer to brilliant studies that are on the way, like, for example, the EBCD study in the States, where we try, or where one tries to get a real good picture based upon both biomarkers, about neuroimaging, cognitive testing, etc., finding ways to identify in an early stage vulnerabilities that predict problems later in life, and try to build up on that targeted interventions.
That sounds promising. Thanks so much. Since we are working in a different field, and you just shared the main bottlenecks, do you see any connections on that, or any common steps how we could resolve each by each, but also working together?
You want me to start? Well, I think we are in the right moment to do that, because we have the Brain Health Partnership just released the document, which is absolutely important. As I said before, the HUN has also a strategic agenda for research, which has been published, and a paper about the brain health plan and roadmap in Europe. I think the key strategies is that's been already mentioned this morning and this afternoon, is to have priorities, to define which are the priorities in the next 5-10 years that in which we can work together. So priorities that we have to be find out and put together, and this kind of meetings in which we find some base things together that we can foster and we can apply. For example, we talk about some basic mechanisms that probably are the base of several neurological diseases. We talk about neuroinflammation and other mechanisms, so this is very important to share. We talked this also before about multidisciplinary approach to several diseases. As a neurologist, sometimes I'm useless, so I need to ask my colleagues, the psychiatrists, we need the rehab people, we need the nurses, we need individuals with neurological and mental disorder to help us, right? So these are, I think, one of the key is to work together with some clear objective and priorities in research, diagnosis, management, with the collaboration of industries, of course, and especially the policy makers.
Yes, that's true.
Some comment. It seems that when the brain disorders are manifest, it's very difficult to treat them. So I think prevention is the key to learn the steps leading up to the fulminant disorder. If we can learn to identify that across many neurological disorders, I think we can develop a lot of treatments. I think it's also very easy to focus on problems and where we are insufficient. But at least in the area of traumatic brain injury, it's been unprecedented increase in knowledge over the last decade through a huge national and international collaborations, not only in Europe, but also in the US. And we heard Professor Menon talking about this international initiative for traumatic brain injury. These are truly needed to learn more about the disorders. So increased collaborations, and I think we in Europe has a huge momentum right now. So there are great possibilities ahead, I think.
Yeah, in my opinion, we have to figure out what to prevent from, actually, in the first time, these young people. In our institute, we have an ADHD research group, for example, and they are focusing on adolescence research. And it's very interesting that besides the normal psychology research, they also involve development of different types of software, actually, to figure out the daily activity of the students or of the adolescents that is involved in the research. So I think that a little bit more involvement of the basic research combined with a holistic approach in this area would be very important as well, but it would need the collaboration of basic researchers, clinical psychologists, for example, and also device or software developers, which is very important.
Okay, Elena, you want to react on that, or?
I also wanted to add something, because there is a lack of physicians, lack of healthcare professionals, lack of neuroscientists. We have to ask the community, especially probably at the educational level, to make this profession more attractive for the young generation, because otherwise, you know, who is going to take care of what we are talking about, right? So we really need everybody, no? We are talking about the Ministry of Education, but really to make this profession really important for the community. Otherwise, you know, in the 10 years, nobody will be here to talk about these areas.
And yes, actually, that also this question popped up in my mind, according to what you mentioned, and later on I will give you the word, Professor Gedom. Can you call the younglings, can you show them interesting points which leads them towards to step into the field as a new generation of that?
I don't know if Professor Dom wants to say something first, or? No?
Yes?
Yes, I cannot see you very well, so please indicate clearly.
Professor Gedom, so I just asked that regarding this sort of conversation, what we elaborated, that we agree that the new generation of physicians, researchers are pretty important, not just answering the $1 million question, but also to provide a stable future for all of us and for the mankind. Can we show them enough interesting role to see the interesting, to let them to see the interesting points of that? Can we involve them enough? Can we show them a sort of perspective for their future and for our future, what actually Elena mentioned? What's your opinion?
Thank you. So again, a complex question. I thank you for that. I think a couple of ideas on that. First of all, agreed with Elena, there is a shortage and there is a workforce problem in healthcare in all of Europe and in many other countries. And I refer at the moment, we have our Psychiatric Congress in Madrid next year, and that is one of the topics there, the problems around workforce, mental health workforce. On the other side, I think we should not desperate. I had this morning a longish conversation with the Royal College of Psychiatry, for example. They say me that there's a massive increase of students who want to do psychiatry. So it's not all bad news. And one of the reasons, therefore, is that the field is becoming attractive for a lot of young people, and that has to do with the societal changes, I think, and with the interest for more holistic approaches. So I think there are a lot of things we can do in making the profession attractive as content-wise. On the other hand, we have also, as Elena indicated, I think a lack of basic certain neuroscientists, etc., etc. And I think the field in itself is fascinating enough content-wise, research-wise. It's enormous possibilities with enormous challenges. But one of the things we really need to realize is that if you want to offer young people nice things to do, you have to pay them. And I don't know how it is for Elena in the neurology, but I know for psychiatry, if you look to what money is spent to research in mental health, most countries do not get above 3 to 4% of all the health research for mental health. So I'm a big fan of the number 10%, that we need 10% of the expenditure for health to go to mental health care, but also 10% for all the research money that goes to health that should go to mental health. So we need not only the content is fascinating enough, but we need other stimuli also, financial stimuli.
Very well said.
Now, this is something I feel strongly about, how to recruit a new generation, particularly for clinician scientists. And I totally follow your idea there. If you have a young colleague coming to you, I want to do research as well, part of my clinical practice. Yeah, great, please join me. Do I get money for that? No, not really. Do I get some extra time to do research? No, sorry, can't help you there. What am I supposed to do? Well, you need to do a lot of administration. You need to fill out those forms. You need to spend all your free time, weekends, evenings, applying for money. Will I get money? Not the first 3-4 years or something like that. And then we wonder why people are not doing, research when you're a clinician. We need to make it more attractive. And I strongly argue that the key thing here is to reduce the administrative burden. It's ridiculous the number of things you need to do as you get one study completed, and it's growing exponentially. Administration has no natural enemy in a way, right? So it just grows, and if you're young, you can choose. For myself, I could have gone only into surgery, would have had a great life. Now I spend the evenings and weekends doing administration. So I don't know if I did the wrong choice. I think this is key to recruit new ones. We are sort of too old to do something else. So, but for the really make it attractive. Yeah.
Yeah, and since I'm directing this former Institute for Psychology, we have lots of psychology students, and in Hungary, psychology is very, very attractive, and I guess psychologists are educated in hundreds and hundreds and hundreds, and we are lucky that we have talented psychologists who deal with clinical psychology, with child psychology, for example. But we have the same problem in here because, the salaries are not very high. If they want to go to PhD studies, then the PhD stipend is not very high either. But I can imagine, actually, if they are doing basic science, that's going to be interesting enough for them to stay within the science. So I think one attractive feature of research and research for mental health is the route towards psychology as well, because they can do nearly as important stuff as a doctor can do. So it's very important to involve not only psychiatry but also talented young psychologists, clinical psychologists in this field.
Elena, you also wanted to ask? add something?
Yeah, I think I wanted to add that we have to be a little maybe more present at university when with the medical students, right, to foster more the attention in the brain areas, in neuroscience. I don't think we advocate a lot as teachers in university, so maybe you know, at in public level we have to be more present. It's the week of the brain, but I think also with the medical students and also even before we should try to advocate a little more.
Yeah, thanks so much. And I think Niklas, you also what you mentioned also, you spoke all of our experience. I think I can mention that. And do you think that the European Union could what the European Union could do to foster this sort of intentions of ours, what we state right now?
No, I think there's a lot to be done in terms of the life as a scientist, not also as a basic scientist, but as a clinician scientist, to make it attractive. Nowadays, work-life balance is so crucial. So if you tell them you need to work 100 hours a week for no extra money, people are not going to do it. That's going to happen. So what can the European Union do? Well, make positions available, 50% research, 50% clinical work, for instance, with good packages. You get some extra money to spend on your research, but also some extra salary to make it worthwhile. I think that's key, actually. This sufferings that we supposed to do in the past, it's not going to happen to the same extent. So I think that's possible. Now, obviously, more funding towards brain sciences, it's crucial. But more money means more opportunities, and also making life better for those actually doing it. And more positions. I know so many basic scientists, they struggle. If they don't get this grant they applied for, they cannot continue after 15 years of good experience. So we need more positions available.
And also, if I may say, less regulation or less regulatory influences on that, because it becomes a nightmare for psychology research that for example, it has to go through the whole system, that if it has a very serious indwelling device development. So I think that this field is a little bit over-regulated, and that has to be addressed at the politicians' level, because it's not going to give us any better chances to prosper, actually.
So I think that several countries in Europe, they have a brain health plan, right? Switzerland, Norway, Italy. So in this brain health plan, where we have a neurological, mental, neurosurgical, everybody from the neuroscience perspective is there, we have to act these plans. We have to share these plans and adapt them according to the country where we live. And so we have the theoretical frames. Now we have to act. So, because we talk, but now we have to act these plans, because they are there. So we just have to move to action.
Don't you think that it should be centralized from the European Union, or it should be declared state by state, not just the plans, but also this sort of tactical steps, one by one?
Each country has different possibilities, have different needs. And so it depends how big you are. So I think we have several plans, as I said, that can be adapted, shared with the community, with the help of the ministers, the different ministers, they are involved. But we have to share them. We have to be aware. And if a country doesn't have, I was approached by Egypt. The Egyptians, they say, well, why we don't do that? Indians, they're doing that. So I think all the other countries in Europe, they have to say, well, we have to raise up and say, we need a brain health plan for our countries. They're there, just share them.
No, basically I agree, but there are differences between in each country, cultural or financial and many other aspects. So I think national plans are needed. Maybe the framework could be more at the EU level, but the details should be chiseled out by the national societies.
Yeah, I totally agree, and again, make it, I mean, diverse and not centralized instead, because sometimes centralization makes everybody's life much worse than if you are freely acting at your country.
But the European community can really force, push, support each country to have a plan and to act.
What's the situation in Antwerp, Belgium?
Very good as to cocaine transportation, but that's another topic, of course. About plans, I think the suggestion of Elena is fascinating, I think. We had, within the psychiatry community in Europe and larger, we are having an increasing discussion at the moment, stressing the importance that every country should have, in our case, a mental health plan, and that needs to be closely aligned, of course, with the brain health plan. Not all countries have that, and in the thinking we are doing with this group, there's also a strong tendency to say, let's approach all large funders in the world and in Europe that fund research in mental health or other things, and ask them whether, if they fund projects in certain countries, that one of the conditions that need to be fulfilled is that a country should have a good, sound, strategic mental health plan, that would become a sine qua non before giving large fundings for also research or projects in different countries. This is a way of stressing the importance for countries to have that. Of course, and as the colleague indicated, it's always wise to have this not too centralized, and we all know that a lot of, at least the healthcare, are national mandates for the countries, but still an overarching, let's say, pressure is a bad word, but a pressure towards the need of having really in every country a well-developed plan, I think that is wise. And on a European level, we could have, on a meta level, some indications how that would look like. And of course, that needs to be translated to every country's specificities.
That sounds very, very great. Yeah, I totally agree with you. So we just touched base on the younglings, we touched base the different action items plans. The question is how we would have more and more fundings to support this sort of plans and ideas in real life. If you would change something among the research grants or any financial support, what you would do?
So another $1 million question in a way. But as we discussed before, and you had a good point about cancer being very successful. Now brain health, brain disorder should be equally successful. And targeting what's really is the key health issue in Europe, the brain disorders. Actually, that's one key thing. But I think we need to stress also that big pharma are sort of pulling out from neurosciences. There's been too many failures, too much money invested to bring them back. I think we just need to be doing a better job harmonizing our disorders and making sure that, with this setup, we can actually have a possibility of getting positive results that will be attractive to them. That's a huge source of income and funding in a way.
Yeah, as I see it, I guess we have to act towards the politicians of the EU because if they are not stressed, they're not going to do anything because that's how things work. So if we had very loud patient organizations, for example, that would really go to the streets and say that they need better mental health care because it's a very big burden for them and for the family, for everybody. This is just like animal rights activists, so they can make enough loudness that reaches the ears of the politicians. So I guess there has to be some sort of motion towards this, because scientists alone, I don't think so that they will convince the members of the EU Parliament that mental health would be very nice. So there should be backed up by patient groups very hard. That's what I think would be better or sufficient.
I'm not a politician, but I think we have to learn from successful stories, as we said before. So I think the only way to be successful if we go together. It's a sort of Troy horse, right? So we go together in force, and then, of course, because the brain is one, but it's so complicated, so diverse, right? So, but it functions as a whole, right? And then, so we have to go a whole, like a very strong force as a brain health, a brain importance, and then, of course, divide, according to the priorities that we said, according to the different diseases, what are, we are saying growing, the burden in Europe. But if we don't go together, I think we will lose everything. So we really have to be together for the victory. I have to say, for the victory together. We have to learn from the past.
Yes, some comment on that. The politicians are obviously very important with all the money they sit on, but also it's a bit dangerous because they may, now it's popular to focus on this one. It could be autism. Nothing wrong in putting money in there, but if you put all the money in one bag, we're going to lose a lot of other brain disorders instead of us dispersing it throughout the brain disorders per se. I think we can learn a lot from other disorders that was treating each one in that sense. So not be too focused from the political side, I think.
Elena has had this great idea to focus on brain and make it multiple. So it's not only scientists, doctors, patients, but also pharma companies and other stakeholders, actually. So it's not purely medical doctor-driven something. It has to be a collective effort.
Of course, also the peripheral nervous system. It's not only the brain.
It's still important. I agree. Professor Gerdom, what would you see in a strategic view of the fundings? How would you see that?
Thank you. A lot of elements have been said, and it's of course very complex how to reach that. But I think essential is collaboration between us as scientists, but also with patients and with families is essential. I think it's essential that, of course, we show the problems, but we show also solutions. So I'm a really, really big fan of good examples and showing solutions in areas that is very, very important. And next, I think we need to show that what we do does not only impact the symptoms of the disorder or the direct things, but the overall quality of life of people and functionality of people. And there I think we can show a little bit transdiagnostic how important our work is for the whole of society and families, etc. And I think politicians are very sensitive to that. So if we can show that we really can make diseases better, okay, but really lives better and societies better, then I think we have a powerful leverage to work with politicians.
Yes, I also agree on that. So we all agree on that we should see from a holistic point of view. And Elena, you also mentioned to learn from successful stories. What's your suggestion? What would be the main keyword what we should use, which worked, for example, in other fields as well, in terms of, for example, generating more and more fundings to achieve our goals, what we stated right now?
Well, again, it's a very difficult question. I think from my point of view, as we said, so to recognize the points that we have in common, right, so in which we can work together and be stronger at EU level. But also, I think we should capitalize a bit more in starting, taking into account all the lifespan, right? So just putting everybody together, make them aware that without the brain capital is a very interesting concept, but for the politician, I think they understand the language, because we have to find a way that we are understood by, we understand each other, but people who are working in different fields, they don't understand us, right? So if we find the common languages, very basic maybe, but you understand when you say brain capital, wow, my brain is so important, right, that I want to preserve it. So I think these are, what is the language that we can share with everybody in the world? So, because we want to tell them that the brain is the most important thing, is the treasure, that you have to protect your treasure, right, with everything you can. So I think we have to find a very common, powerful, strong language.
Yes, one thought, we want to persuade pharmacological industry to put billions of euros into clinical trials. That's of course risky for them. The easier ways are actually that we continue to share and collaborate. We were a small country in Sweden, 7 neurosurgical departments. If we do look for neurocritical care, some basic aspect we do totally different in each of these 7 ones. So just by sharing our data, we can just do this comparative effectiveness research and learn that, okay, the outcome seems better there and they did like that. We can learn a lot from that, and that's much cheaper than the big pharma if they are still reluctant to give us money. So that's one thought.
And I think also we have to find the right persons that would communicate this to the EU, because, I mean, if just a general doctor goes there, you know, then it can tell you that it is fun to do, but he's not going to be, I mean, able to convince the politicians that it is really a good thing. So I guess it needs some sort of professional advocate, actually, that is trained and well educated in terms of how to deal with politicians, because that's not an easy question, at least in Hungary. You know, I can imagine that's the same in the EU or everywhere in the world.
And if you would describe this right persona or a group of personas, how would you describe that? What would be the, since we have multidisciplinary knowledge, who would be the ideal person who could translate and translate this sort of knowledge towards the politicians or towards the EU to get more fundings, to get more support on that?
So you have to learn how to do it, right? So what the AN has started, but I think it's an initiative that can be copied by, of course, other associations, is an advocacy school. It's 1 year training for neurologists, but it can be, you know, for other disciplines, in which they learn how to address a politician, how to talk with individuals. I don't call patients anymore, individuals with a neurological or a psychiatric disorder, and to advocate, to be testimonials, and this you have to learn how to do it. It's not just we were born being able to do it, so you need to be trained. So this is a school that we started the last year.
So it's already existing?
Yes, yes.
I'm amazed. I didn't know that. This is a complete different world to mine. You know, surgery, research, and the political world is completely new to me. So I have basically no idea. But I think it's basically spending the time talking to the right people and convincing them of the importance of what you do and the relevance of all the neurological disorders, neurosurgical disorders that's out there, how it impacts the life of ordinary Europeans. I think the message is clear for all of us, but how do we translate that to the decision makers? I don't know how to do that because I've never done it, basically. But I think we need. For a year? Okay, I'll try to.
Yeah, it's very nice that it's not going to be lost in translation because you are actually making this school happening right now. And just a question: do you think? So, what's your time frame on that? So, is it 1 year and then?
1 year. There are different modules, but I think it can be shared with. There are different modules, right, online. But I think it's an initiative that we can share. I think it's not a problem. Also for psychiatrists, right? Because I think there are a bit different needs. But eventually we can have an international school with a multidisciplinary aspect. I think that we would be very interested to collaborate to a more multidisciplinary advocacy school for the brain in Europe.
Yeah, very nice.
What do you think, Professor Geert? What
I think it's
the ideal persona who could transfer this sort of information or a bunch of information?
I do not think there is one ideal person. I think, unfortunately, politics goes by sometimes randomized step, etc. So you need to have, of course, people, and like the School of Elena, but I'm pretty sure that in all industries and sectors they have a lot of training for people how to lobby and talk with politicians, so we can learn from that field also. I personally think we need to have good qualified people with experience and give them the time and the resources to do the lobby work and the talking, because it's not only the competencies, but it's also having the time and the resources to do that. That is very important. But I think it's also super important politicians are sensitive what happens with their voters. So these things need to go hand in hand. And if you have in countries good examples for things that work and that show result, it will put pressure on people to pressure their MPAs, etc., etc. So I think we need to have at least 2 or 3 ways of approaching, going from the bottom up and then on the top in talking, but also with the doing in the different countries, etc. So I think it's a multiple approach that we need.
And also, I guess, to coordinate it with pharma companies and device maker companies. So I guess it includes that as well.
And what do you think? You mentioned that it takes time. How much time? What would be your assumption for that? I'm sorry. I'm looking to Professor Geert.
Time to do.
You mentioned that it takes time to acknowledge all of this information, this translation, and so on. What you just recently mentioned, and it takes time. What would be the time frame? What we should expect for?
Well, I'm not sure we understand each other well. What I was saying is that if you train people to do talking and the dialogue with the policy levels in Europe, you need to provide them also with time to do this. It's my experience. I spent, just like Elena, I think, quite a lot of time to discuss and try to influence, etc., etc. And most of us medical associations, we do not have the means to say we have 3-4 people that can do full-time this work and full-time try to influence and contact. So what I was saying is people need resources and time, and maybe we should think about how we do that better. Other industries spend enormous sums of money to pay people for very much time to influence these things. So that's what I was saying. Sorry.
Thanks so much. Elena, you also?
Yeah. So what I think we can be a solution is to ask each national societies, for example, neurology, psychiatry, neurosurgeon, neuroscientist, to send one person to represent the nation to this eventually school or some initiative. So, and then, every third year, this person can be replaced. But I think we don't need an army, but, we need very qualified people to do that.
Right. So time flies, and my last question as a closure, how would you see the near future or the midterm future on your field which are related to this conversation what we just acted right now?
In terms of the development, in just like software or device development, I'm not very happy actually with what is going on, because it seems that the regulations are getting strict and stricter coming from the EU, and this means a burden and a handicap for not only research but also for medical treatment, I think, and we have to get together and somehow solve this $2 million question. And that would have been easy, because you don't need money for that, most probably. You just need to change people's mind a little bit, at least at a political level. So that's what I can add to this question.
Thanks so much.
Finally.
No, I would like to take an optimistic stand on that. I mean, I think we have so great momentum these days with the advances in biological knowledge, the technology, of course, I have to say AI. I think one of our fields, hopefully traumatic brain injury or movement disorder or dementia, whatever, there will be a breakthrough. And that breakthrough will create more momentum, more energy, spread out to other neurodegenerative or neurological disorders. So I think that's what we're waiting for, the breakthrough of one key disorder. We have that, a lot of more positive things will happen. That's my prediction.
I also want to be very positive, because this is a special momentum, right? That we, besides all the wars that we have in Europe, I think we still have the passion. We are here together. We have still the hope that because of the technology, the advances that we have in neuroscience, that we will improve and we will reduce the burden of brain disorders in Europe.
Right, and Professor Geert, as a closure.
Yeah, I echo the optimistic tone. I'm pretty optimistic on various levels. There has never been so much attention for mental health in the last 50 years as in these last years. In the public, in the media, etc., it is reflected also by not enough but a little funding by the European Commission, etc. On the other hand, I see major breakthroughs and possibilities as to the science and the translation, also in connection with brain health, etc. So I'm quite optimistic. Abstraction for all the horrors that are happening in the world at this moment, and we really should not be naive. I'm also very optimistic because I see the collaborations on international level, as we do now as we speak, but on many platforms increase. So I think this also gives a lot of possibilities. So I'm optimistic, realistic, of course. We need the means to do so, but I think we have a good path and an optimistic path before us.
Thanks so much. I'm super glad to hear that, because personally myself, I'm also a super positive person. The glass is always not half empty, but half full. So thanks so much for your time. I really appreciate that. Geert, István, Niklas, and Elena, I really appreciate your time, your sincere answers for these questions. I hope you enjoyed this conversation. And I just would like to point to the audience, if you would like to talk to any of us, just feel free to stop us at the corridor or just email us. For sure, we are happy to answer your questions too as well. Oh yeah.